The patient is a 70-year-old African-American male who presents to the clinic today complaining of substernal chest pain that he's had for 5 days. He's also complaining of being dizzy and sluggish. He said there's nothing that precipitated the pain, nothing that alleviates the pain. He just sits through it and deals with it, but he felt he needed to call the emergency line last night because it was bothering him so much. He says that a couple months ago when he had an EGD, he was in AFib and he didn't know he was in AFib. And because of that, he likes to be more aware of something going on with his heart, if he's having any tingling down his arms or anything like that, which he said he did not. He can't say that anything precipitated the pain and nothing alleviates the pain. So he comes into the office today wanting a full workup. He wants a CT of his abdomen, CT of his chest, and everything to rule out any type of heart condition. He wants lab works and everything. So on observation of the patient, he's not under any distress. He actually says he's not having the pain right now. So his pain is a 0. His blood pressure is good. It's 117/81. His pulse is 56, and he's sitting 97% on room air. So my assessment for this patient, considering his history, which he does have a history of GERD, he is on a PPI for it, so this could possibly be just reflux since he's not having any distress right now. The patient, though, would know what reflux feels like, so I think it's more concerning that he said it's chest pain that he's had for 5 days. So something I would want to ask, would you refer the patient, send the patient out to the emergency room right now, although he says he's not having chest pain right now? Would you do troponins and a full rainbow of labs like CBC, CMP to see what's wrong with the patient? So my plan for this patient today in the office is to do an EKG because we have that capability in the office, and a referral to cardiology since he's not having any chest pain right now, and to follow up with us in 3 days to let us know if he's still having chest pain, and we'll review the EKG in office today to see if there's anything going on. If there is anything, of course, we would immediately send this patient to the emergency department. But for right now, we're going to do the EKG and referral to cardiology.